One of the biggest mistakes people make after their knee replacement is that they don't know how to accurately rate their pain on a 0 to 10 scale. A 0 to 10 rating scale is used universally with most healthcare providers in order to gauge what intensity of pain you're experiencing. And most people struggle with this number, and the key to remember with it is that it's your pain scale, not somebody else's, not your neighbor's, not the guy beside you. It's a 0 to 10 scale for your experience in that moment. So 0, of course, is no pain. Your knee is totally pain-free. And 10 is the maximum amount of pain. Think getting your arm cut off without anesthetic. That is extreme pain. 10 out of 10 is the highest. You can't have a 12, you can't have an 11, 10 is the maximum. And in a maximum pain, you can't cope. You need to take action immediately to get your pain under control. Now let's go back down to the 2, 3, 4 range. These are types of pain where, yes, it's there, it's present, you notice it, but it isn't nagging and causing you discomfort to the point where you feel like you need to do much about it. So think of maybe a sunburn. It's there, it's present. Sometimes you notice if you bump it, but you could kind of cope and deal with it. Now moving into the 4, 5, 6 range, this is actually where we sort of want you to be. Not that we want you in pain, but healthcare providers are kind of hoping to work with you in that middle range pain after surgery, because knee replacements aren't going to be pain-free. You may be the lucky unicorn who didn't get any pain after surgery, but for the majority of people, pain is the main problem they experience after their knee replacement. So we're not trying to eliminate pain altogether. We're just trying to get it to a manageable level where you can make some progress. If it's in that 4, 5, or 6 range, that is a range that you can at least make some progress with and deal with to regain some strength and flexibility and activity tolerance. Okay, now we're getting up into the 8, 9, and 10 range. If your pain has creeped up into this high range, you want to be taking immediate action to try to get your pain to come back down again. Whether that's medications, whether that's icing, elevating, activity, meditation, anything that works for you for pain management, this is the time to take action. When you allow your pain to get up into that high level, it can be extremely difficult to get it to settle back down again. And so we want to avoid this roller coaster of highs and lows. We want to just keep it kind of on that level playing field in the mid-range as you recover. So if you feel that pain starting to creep up, that's when you want to take action and get on top of it. When your pain is at a maximum, you can't think, you can't sleep, you can't function as a human being, and you really don't want to move around. So a way to know if your pain is being managed effectively after your knee replacement is knowing, am I actually doing things or am I avoiding them because I don't want the pain that is associated with that activity? Don't forget, you always have to test things out. So don't avoid things altogether. Like, if it's been 3 hours and you haven't been up yet, don't anticipate that pain until you actually give it a test and see where your pain number is. Finally, make sure you're accurately telling your healthcare providers what you are experiencing as far as pain goes. Not all medications react the same for every person, and there are plenty of pain control options out there if you are struggling. Your pharmacist, your surgeon, or your family doctor are all capable of prescribing you different medications, and it is definitely not a one-size-fits-all. Sometimes it even comes down to needing not just pain relief, but maybe a muscle relaxant or something to coincide with the pain reliever. So I wanted to give you this video information so that you do not suffer in your recovery after your knee replacement. Yes, it is painful, but no, you shouldn't be suffering. So take this advice and be on top of knowing your pain inside and out so you can get the accurate information to your healthcare team and get them to give you the right solutions to your pain.